Do you have a child with behavioral problems or an adolescent who's acting up and you're just not sure what to do? Let's get to the bottom of this, and you may be surprised how complex this set of causes can be. It's much more complicated than, hey kid, get it together and stop doing that thing. If only life was that simple. As a reminder, I am a doctor, but I'm not your doctor, and this is purely educational information. So when a child's having some behavioral problems, could just mean that they're not getting what they want and they're acting up. But it could also be something more complex. And you want to be able to tell the difference. So, what kind of things are going to make you want to look more deeply? So, behavioral disorder specifically are concerning when they are relatively uncommon for that child's age, seem quite persistent, or are really severe. So, the first and most obvious thing is you don't want to assume that it is actually some kind of mental disorder, brain disorder. It could just be that your 13-year-old is discovering the darker parts of life. And the truth is, we're all a mixture of good and evil. Human nature is not always good. So people can act out for status, financial gain, revenge, illegal activity. So don't assume that everyone's an angel. Now, outside of that, there's other things like disturbances in the family relationship. Because kids are not often able to articulate and verbalize their emotions in a granular fashion, they often will manifest distress through their bodily symptoms. Sometimes that's with something called somatization, headaches, body aches, but also when there's a problem with the parents' relationship or with their relationship with one of their siblings, this can often manifest in some kind of behavioral disturbance on their part. So you want to think about what's going on in the family that's making the child possibly act out, not just to get attention, but to show distress. Also as a manifestation of externalizing an overwhelming feeling of uncertainty, or maybe they're catastrophizing. They don't know how to deal with that. So that's an important consideration behind this. In addition, there's something called oppositional defiant disorder, which is a clinical disorder where the child shows hostile, defiant, argumentative behaviors directed at authority figures. And you might think, well, that's just being a child, right? How is that a disorder? That's just my kid. It has to go above and beyond, refusing to comply with rules, arguing, losing their temper. It has to not include violating the rights of others. If it includes violating the rights of others, like serious violence, then we think of something called conduct disorder, which, especially if it's occurring before age 10, is where we see bullying, stealing, aggression, physical violence, in addition to some of the other characteristics mentioned, and sometimes even destruction of property, theft, deceit. And of course, kids do silly things, and human nature is not naturally good, and anyone who's a parent probably knows that and would laugh if you said that human nature is naturally good. Morality needs to be cultivated over time. However, there are variations on this theme, and conduct disorder often has an increased likelihood for later adult problems as well, such as antisocial personality disorder. So something to keep in mind. Now, ADHD, garden variety ADHD, also is going to manifest with some behavioral disturbances, and you want to be able to distinguish between something like ADHD and something like conduct disorder. So you want to look for these associated symptoms because sometimes they are overlapping. You can have a lot of ADHD with these other things, but also ADHD can be on its own causing some behavioral issues. So you want to think about attention, hyperactivity, fidgeting, interrupting, difficulty with organization, and all the other symptoms of ADHD. So you can disentangle all these things. There's the autism spectrum disorder, which can also manifest with emotional dysregulation. But again, there's also very characteristic features of autism that you want to be able to include in your assessment. Difficulty with understanding the minds of others, social cognition, possibly language delay in some cases, narrow interests often in technical things. And you can't really figure out how to intervene and be helpful if you don't know what's causing things. So keep that in mind. In addition, there's very common major depressive disorder, which is unfortunately increasing in adolescents and children these days. And here, there's going to be all the classic symptoms of anhedonia, difficulty enjoying things. And often in children, especially young boys, you're going to see more irritability as a manifestation as opposed to low mood. But also think about sleep disruption, feelings of guilt, lack of interest in things, appetite changes. In addition, Bipolar 1, bipolar 2 disorder, very hard to diagnose in children. Some controversy about whether it is even something we can diagnose in young children. Something to keep in mind, especially if you notice episodes of mood fluctuations lasting more than a couple hours, more than a couple days. Also, adjustment disorder. And here, there's often a stressor, and we see behavioral problems in response to the specific stressor, and it doesn't result in symptoms that would meet the criteria of something like major depressive disorder. But yet there is a connection between an acute stressor and behavioral reactions. There's something also called disruptive mood dysregulation disorder. And here, the key thing is that this is a persistently irritable or angry mood between episodes, meaning that what you're observing is not episodic, like a major depressive episode that somebody goes into and then comes out of, or a manic episode in a bipolar disorder. And you might say severe recurrent temper outbursts, that's just part of being a child, right? And that's my kid. But here it's a degree of severity that's out of proportion to the situation and inconsistent with what's normative for the developmental level of the child. So that's the key thing to think about, because a lot of these things that I've mentioned, every every kid has elements of all these things. So it's all about where they are on that bell curve, where they are on that spectrum. In addition, you want to think about post-traumatic stress disorder and acute stress disorder. If there's an actual traumatic stressor, so this can't be like, I got a bad grade and I'm traumatized, or somebody called me a name and I'm traumatized, or I have a microaggression against me and I'm traumatized. It has to be typically for post-traumatic stress disorder, there's a life-threatening stressor, like being in a car accident, witnessing somebody get mugged or almost shot. And then you want to see if there's nightmares and flashbacks and hyperarousal and avoidance of cues. People can act out in light of their traumas as well. But you want to look for the associated symptoms or you can't get the diagnosis right. In addition, there's something called stereotypical movement disorder. Sometimes kids will have repetitive, purposeless movements, and they can look like they're acting out, but they're actually part of this movement disorder. Things like hand waving, body rocking, or head banging. And the key thing is that they're purposeless. They're not functional in social interaction. And for example, in autism, some hand flapping can happen, but that's not a stereotypical movement disorder, even though there are stereotypical movements happening in autistic presentations. So it's a careful diagnostic picture you got to attend to. In addition, this would have to interfere with normal activity or can cause bodily harm to be a movement disorder. Similarly, a child with intellectual disability or a intellectual developmental disorder is going to have a different presentation. Specifically, they're going to have difficulties with their cognitive ability and its associated manifestations in daily life. So there will be a separate diagnosis normally associated with any behavioral disruptions. Now, you don't want to overlook the most obvious causes and the most common things around. If you have a whole bar in the house or a wine cabinet or a bunch of spirits sitting around, the child may discover this one day and become intoxicated. This is going to lead to disinhibition and all kinds of behaviors that you don't want to rule out, but you want to also rule in this cause when there's also evidence of it. So just because the child is acting weird, you don't want to assume they're drunk. Look for additional evidence. Do they smell like alcohol? Do they have other evidence of disinhibition, euphoria, etc.? Similarly, there could be a developing substance use disorder. So for example, somebody could be acting out because they're, especially in the later teen years, as they get closer to 18, getting involved with their peers, illegal activities can emerge that are associated with buying drugs, selling drugs. And sometimes people will have to act out in order to get resources. For example, they might steal from grandma's money jar, or they may be lying to pay for a habit that's developing. So you got to think about that as well. In addition, schizophrenia, which is often something that does manifest in the teen years, typically the late teens, you want to think about that as a first episode presentation, which is quite rare, but also has the associated voices, paranoia, and such. Similarly, something like kleptomania, you might think, how is this even a mental condition? It's an impulse control disorder, technically, that results in an irresistible urge to steal. And you might say that's just the excuse of every bank robber. But oftentimes in this syndrome, we see the items stolen have little value, and there's often this paradoxical relationship between the behavior and the value of the thing that the person is stealing. But I agree. A lot of mental disorders do have this questionable flavor. I hope I've been able to give you some greater context to any behavioral disruptions you've observed in your child or someone you love, so you can try to figure out what to do and get some help. If you've enjoyed this and you want to see more videos like this, please can subscribe and join my free newsletter, medicalwisdom.org, so you can stay on top of these kind of opportunities. Take care.